So, how would you argue that more anaesthetists should be using the isolated forearm technique?
I'm sure most anaesthetists will have experienced a scrub nurse or the surgeon saying, "Oh, the patient's moving her left foot." To me, that is the ideal opportunity for speaking to the patient. You know they can move their left foot, and you ask them to move their left foot, and then you can be sure whether this is just a reflex because the surgeons are doing something that's causing the foot to move, or whether in fact the left foot is the only thing the patient can move, and that's what they're doing. Which takes me back to my time as a senior trainee in Aberdeen, when I was in charge of the emergency on-call anaesthetists, and one afternoon I walked into an operating theatre just to see how the trainee was doing with a particular laparotomy. Just as the scrub nurse said, "Patient's moving her left foot." And I said to the anaesthetist, "What are you going to do?" And he picked up a syringe of, I think it was pancuronium, and said he was going to give some more muscle relaxant. And I said, "Are you going to do anything else first?" And he looked very bemused and didn't really seem to know what. So I actually spoke to the patient, and using a Christian name, I just said, "Francis, can you just waggle your left foot for me?" And she did. And I then said to the anaesthetist, "What are you going to do?" And he said, "Well, I'm going to give some pancuronium." I said, "But the patient's awake. Francis, can you just waggle your left foot for me, please?" Waggle, waggle. "What are you going to do?" "Give some pancuronium." "But the patient's awake." And he said, "No," he said, "the patient cannot be awake. I am giving an anaesthetic." To which I said, "No, I think you only think you are giving an anaesthetic." And so we deepened the anaesthesia, and a few minutes later the responses stopped without any muscle relaxant. So I think this is an important thing. The patient moves some part of their anatomy, they wiggle their eyebrows or whatever. Ask them to do that, and then you have an insight into it. And this is a very useful introduction for actually using the isolated forearm technique.
Yeah.